got my spirometer going. I haven't managed to get it above 1,000 just yet, but it's something. I'm trying to keep my lungs. Actually, I don't really know what the purpose of it is for. It's usually so you don't get pneumonia, but I already have pneumonia, so I'm not quite sure what I'm using it for. But anyway, I've been using it. And you can see I'm just making a video here because I haven't made one in a while. Just kind of do an update video. I'm sitting up in my chair. I'm not wearing my oxygen. It's all good. It's 15 days in today. Today is March 7th, according to my calendar. 15 days in. I still have on my chest tube and a couple other things. I got the original chest drain out, and it keeps flip-flopping back and forth. I got all my IVs out, and my arm has seen better days, but because they're utilizing my port now for the antibiotics and such and medicines. I've been doing a lot better. I can breathe a lot better. Still have to wear my oxygen at night because I kind of have panic attacks in the bed from not being able to breathe and the dryness and everything else. But and plus the fluid is overflowing in my lung again. So when nighttime rolls around, I pop my oxygen back on. But you see my voice is back as well. That's good for the last 2 days. And I can move around better with the help of pain medication and, of course, the walker and my oxygen again. So all baby steps, much better. I'm supposed to be getting, we went back and forth, a step forward, 2 steps back. We're supposed to be getting my semi-permanent lung drainage bag attached. And I guess I'm not getting it right this minute now because, as it turns out, some of my chemo meds act as blood thinners, and in order to put that in, it would potentially bleed out. So it's dangerous. So we're just going to wait till I'm off those meds for at least a week, week and a half. And excuse me, I may get discharged and come back to the hospital for that procedure. In the meantime, I still have my CT chest tube, and I can't go until that's out, of course. There's talk about taking it out when it gets below 25 cc's of fluid a day. I'm still at about 80, so we'll see. I mean, they put that in after my cardiac window surgery. Excuse me. We'll see. I'm getting there. Trying to think what else. The food in here is insane. I mean, I don't even know what my dietary needs are. 1 minute, I'm low carb. Then I'm cardiac diet. Then I'm low salt. Then they were going to advance me. Then they were feeding me baby food. Like, it's all over the place. It's inconsistent, and it's a mess. I could only eat about 10 things. I started out with no appetite and then NPO. Then I gradually got an appetite, but everything tasted like sandpaper and dry, everything, except for hummus, poi, just, I'm not allowed hummus, but things like that. Broth, the coconut water, which everybody's been nice enough to bring me. It's a blessing. It's getting my electrolytes up, so I don't have to choke on that huge electrolyte pill anymore or burn my arm out with it. And the Greek yogurt, of course, that you've been bringing me. And Jenny brought me the toothpaste without that stuff in there that was causing the mouth sores. So the Sensodyne, that's also helping take care of the mouth sores. They're still there, but it's been improved since I've been using it. So a big shout out to her for that. My scalp hurts for some reason, so I keep using this brush to kind of massage it. But I think my pneumonia is improving, and my foot and ribs that are cracked, I guess they don't feel too bad, probably because of the pain medicine. Altogether, it lasts pretty long, and I try to space it out and take it as infrequently as possible. And then eventually I need it again because it just feels like this chest tube is pulling, and it's creepy. It feels like there's a rubber worm or something in there. It's very creepy. I'm still digging the pajamas and not having to lay on all this balled up sheets and stuff. At one point I had to take a Benadryl because I was getting a rash on my back from the sheets and the chucks, and I kind of keep arguing with them. Why do I need to sit on all that stuff when I'm able to get to the bathroom in time? Like, it doesn't make sense. Like, I just take them off and throw them off because it's not comfortable. It hurts, and it's stupid. I'm getting irritable. The food situation makes me irritable because, again, when I'm allowed to eat food, I'm getting the same handful of meals every time. Basically, poi broth, a super moist piece of fish, salad with vinaigrette dressing, honey lemon tea, and orange juice with every meal. And yeah, that's pretty much it. One or two things here and there, and no variations, none. And pretty much every time they send a tray up, it's bizarre. I don't know who's working down there. They'll send me a salad with no salad dressing. Then on the next meal, the tea with no honey lemon. Then mashed potatoes with no gravy. And gosh, what else? I thought, let me try a piece of bread. I haven't been able to eat any kind of bread or crackers or anything, so I thought I'd try one. And well, they sent up their butter, but no roll. It's really weird. I don't know why it's so difficult. And instead of my orange juice, I got Crystal Light or something. And I don't drink that garbage at home, so it's difficult to try to drink it in here. And I just refused. I'm not. Same way I refused the Yoplait yogurt with the 20 and 30 grams of sugar, and the Boost with 40 grams of sugar. I'm like, no, I'm trying to stay alive, not eat this garbage. I mean, so again, God bless all of you for sending me coconut water and my Greek yogurts, and and the pajamas. I mean, and the toothpaste. All those items are a huge blessing. I'm pretty good at being a professional patient, being that this is my 42nd surgery, and I always have my bag packed. But with each admit, there's still some items I find that I could use, and I've been updating my list for my bag, and that's going to include these things moving forward: the Sensodyne toothpaste and the coconut water, etc. And anyway, I wanted to let everybody know. Thanks for your thoughts and prayers, and I'm still doing okay. Pretty much just lay in bed all day and then get out of bed, walk to the bathroom with help with a walker, go out in the hall with the walker around the pool, and come back. I'm a lot less dizzy. My legs feel strong. I'm not able to look forward when I'm walking. It's still, I feel everything's in slow motion, and I'm kind of watching myself go through the motions, so I just pretty much keep my head down. But I'm doing it. It's all right. It's better than before. And once I can get all these tubes and drains out, it should be better. The plan right now, again, it changes every day, but the plan right now on Saturday night is come Monday morning, God willing, they'll puncture my lung again because it's overflowing with fluid. Initially, they were not going to puncture it because I need to get that semi-permanent bag in there. And it's better to be kind of full of fluid for them to be able to insert it properly. But apparently, since I have to wait over a week to be off these blood thinning chemo meds, now we just can't let the fluid keep piling up in there. It's bad again, and it's hard to breathe. So anyway, I'll be getting that drained Monday again, same as before, laying over the table on a pillow, getting my back numbed, and a big needle draining it. And we'll see what comes out this time. That big 1.5 liters last time, there was more, but they have to take it in small amounts so it doesn't collapse my lung. So I'll have that done. And hopefully my CT chest tube here will stop making a lot of fluid, and I'll be able to get that pulled. Then as far as everything else, I'm assuming they'll send me out, maybe. Won't be going home. I have to stay in a nursing home, like a skilled type of facility for rehab for a couple weeks or a month or two while I'm having my drain in and learning how to walk again without a walker and all that stuff. Blah, blah, blah. But I'm doing good. I'm not letting them take me to hospice. I refuse it. After I leave there, then the nurse will come to my house for a while. And then, eventually I'll be back to normal probably in the next couple months, whatever that means. I need to switch chemo meds again because these clearly don't work, obviously. if I'm in cardiac tamponade and, pleural effusion again. So normally every 3 to 4 years, I got to switch meds, and it's time again. It's a blessing and a curse because the capecitabine causes so many bad things like the hand, mouth, foot syndrome and just, that neuralgia and neuropathy. I mean, my brittle bones, just mouth sores. I mean, every possible problem. It's all the stupid capecitabine. So now that it's no longer working, I'm kind of like good riddance. And hopefully the next stuff is better. Some of them are better and some are worse. There's really no saying what can happen. The Taxotere was really bad. That knocked my hair out. That was a nightmare. I didn't think I was going to want to survive that one. It was just, awful. But I'm going to be positive and think that hopefully it'll be a better one, not worse. Some are okay. And eventually, I can take some more pain meds again. Just wanted to shoot a quick video, and I'll get some help to get on that bedside commode and probably brush my teeth again and get back in bed. And anyway, I'm trying to just pay bills today and get my cruise canceled. I'm supposed to be on that in like literally 2 weeks. I can't, of course, because, I don't feel good. But aside from that, could you imagine if all this would have happened when I was out to sea? What a nightmare. Thank God that God's always watching me. The boat would have had to dock at the nearest, wherever we were in the world, station and pull me in, and it would basically ruin everybody's cruise. Just have to get me off the boat, and God knows what hospital I would end up at. And it could have been a potential for a lot worse. Lucky I wasn't on the boat. It happened before the boat. Lucky I got to go on my camping trip before this happened, because I'm going to have to really scale back my life now, having a semi-permanent bag attached to my body. How to keep it clean, right, and not get it infected, and among other things. Initially, we were talking about just having me come to the hospital every couple months and get the lung drained, but basically in a 2-week period, after having that huge bag removed, in 2 weeks it's overflowing again. So it's basically not practical or feasible to have to come in every single week and get my lung punctured, because again, that could be infected. And there's a lot wrong with that. I don't want to get my lung punctured every week. It sucks. Anyway, the bag's gonna suck too, but it seems like a good idea. The lesser two evils, and hopefully I'll be able to do that complication free, and hopefully, like anything, just have to get used to it. And I don't know, it is what it is. I mean, what choice do I have? That's about it. My voice did come back again, which is great, but apparently when the doctor was having me say the ENT doctor, apparently your vocal cords kind of flutter and attach, and I guess mine for some reason are open and barely fluttering, and there's a big space in there and a deviated septum and a hole. So I'm not sure how or why. It kind of makes me wonder if all these years having runny and bloody noses, if it's because it's been deviated all these years, or I don't really know what happened. I mean, it's clearly collapsed in there. Who knows? All I know is maybe a speech pathologist will fix it. I still haven't seen any. Thank God they gave me the real food again, and I can get away from that baby food stuff, because I was getting really irritated not being able to chew and reach satiety. And right, because if you don't chew food, you can't reach satiety. Your hypothalamus is not producing leptin, and it basically you can eat 35 gallons of baby food, but you're not chewing anything, so it's never going to happen. So I was begging for at least give me some gum so I can trick my body into satiety. But it's basic neuroscience, and hello. Anyway, thank God I got the food. The fish came back in a solid piece and not pureed, so that was like amazing. It was cold and missing items, but hey, I'm not going to complain. At least it's food. And I always got my coconut water. And something's beeping again. Something's always beeping. I'm strapped down to this chair as if I move too much. Its alarms start going off, and at first you think you hit the jackpot at Las Vegas. But it's really because I can't escape in the chair, and then I think, where the heck am I escaping to anyway? I've got so many wires and cords, and it hurts to basically move more than 1 foot. I mean, really, it hurts. So where the hell am I going? But anyway, let me see if I can make it happen. Let's see if I can even stand up. It's hard. I need help. I don't know if I can stand up by myself. Wait a minute. Okay, get ready for this alarm. If I can do it. Ow. I need pain meds. There it is. I'm escaping from the chair. Okay, anyway, better hang up before I have a super long video again. I just wanted to give you guys an update. I'm still here at Queens. Thank you, Deb, for trying to send me the pajamas. Hopefully they should be here Monday. Hawaii is weird. Like, we all have supply chain shortages, and people are closed on the weekend, and it's always just all over the place. You know, hopefully they know I'm up here in Tower 6, so hopefully it'll get up here eventually. And thank you so much. In the meantime, I'm still hanging on. I think the worst is over. I don't feel like I'm going to die again anymore. It was really good that I came to the ER. I'm sorry I didn't come sooner. I'm sorry I didn't think to come sooner. I was so overwhelmed, and I had a really close call again. But once again, through the grace of God, I'm still here, and all your prayers and everybody helping me and looking out for me. And I'm so grateful to all of you. So thank you so much. And I'm going to log off now and, I don't know, I guess try to get help to go to the bathroom and get back in bed again. But thank you so much, everybody. And for all of you going through similar situations, I hope, really hope, that I can encourage and inspire you to not give up and to know that things get bad, but you know, there's always a light at the tunnel. Just stand your ground, be ornery. Don't let them take you to hospice. They can't just take you away. It's up to you if you want to live. You just have to fight for it and make it happen, and don't let them take you. And that's all there is to it. You still have rights. You just have to be strong, and hopefully you have people in your life too that give you a pep talk the same way you've been pep talking me when I start doubting myself. And just, I'm grateful for all of you. So thank you so much, and I will talk to you again soon. All right. God bless everyone. Aloha. Thank you.